Health officials in Trinidad and Tobago are keeping a close eye on a potential coronavirus vaccine which has been reported internationally. Epidemiologist Dr Avery Hinds says they are excited about the experimental vaccine but believes it is still too early to say how effective it would be in the long term. Based on this, he says the Health Ministry will remain cautious at this time. Sunil Lala has the details.
That it is still, as we say, early days yet.
There's a glimmer of hope on the horizon following the news of a potential coronavirus vaccine which has been shown to prevent more than 90% of people from being infected by COVID-19. The developers, Pfizer and BioNTech, described it as a great day for science and humanity, noting it has been tested on over 43,000 people in 6 countries with no safety concerns so far. But epidemiologist Dr Avery Hinds says while local health officials are excited about the potential vaccine, several issues need to be addressed.
We've actually indicated that an additional 2 weeks would be needed to have enough information to take to the vaccine regulators with regard to whether to proceed further in licensing or allowing the further use of this particular vaccine.
Additionally, Dr. Hinds explains that this experimental vaccine uses the introduction of genetic material as opposed to the protein coat, which is usually what is used to train the immune system.
The reason that we're not sure exactly how this will go, but the short-term results that they've seen so far have shown what they said is a 90% protective effect.
And while the short-term results show the vaccine is 90% effective, Dr. Hinds says this number could reduce as the pool of persons tested expands.
We have to bear in mind, however, that the number of persons who would have developed COVID and the cohort that they would have been compared with is still relatively small, and that as additional data comes out of that study, the actual percentage protection may change.
Dr. Hinds says the long-term effectiveness of this vaccine is still unknown and notes that the Health Ministry will continue to maintain caution before deciding what this new development means for this country. Sunil Lala, TTT News.